The medial collateral ligament, or MCL, is on the inside of the knee and works with the lateral collateral ligament, which runs along outside, and the cruciate ligaments inside the joint to provide support and stability to the knee. These ligaments anchor the femur in the thigh to the tibia in the lower leg and work together to stabilize the joint. Injuries to the MCL happen most often as a result of trauma during a high-contact sport such as football, when a tackle or other collision pushes the knee sideways. In general, if the MCL is torn, it also means that other structures inside the knee, such as the ACL, are also damaged. Symptoms include swelling and pain. In cases of sprain or partial tears, rest, using crutches to keep weight off the joint, and physical therapy will enable the injured MCL to heal. However, if the MCL is completely torn, surgery may be necessary to repair the ligament or reattach it to the bone. Athletes can minimize the risk of MCL injury by warming up properly before training or competition and by strengthening the MCL and other knee ligaments with strength and conditioning training. Most importantly, if you've suffered an MCL injury, take the time to let it heal before returning to sport. Returning to competition too early will lead to greater damage to the joint.